student has tests in Wuhan. Zero infection. That means if you protect yourself well, you use the spring, you wear the gong. So this is very good protection.
ECMO is a little bit a limited resource in Germany because we can't get the disposables. Do you have any idea about the percentage of ventilated patients that use ECMO?
Wuhan Union Hospital and Duisburg-Essen University Hospital have a 30-year history of friendship and many examples of successful cooperation in the past. As the pandemic continues and 10 coronavirus patients have been admitted to Duisburg-Essen, doctors there suggested having video conferences with the Wuhan side. Today is their second time.
We really need to get prepared as good as possible for this outbreak. It will come and it will increase in Germany, and it helps so much that we can discuss cases and get information from our friends in Wuhan, how we can do diagnostics and how we can do the treatment of the patients that we will see here in Germany as well. I mean, you probably know the situation in Italy, and we really want to be better prepared than the health system in Italy.
At the beginning of the outbreak in Wuhan, Duisburg-Essen sent condolences and about 50,000 euros to start joint research for COVID-19. We appreciate their friendship very much. The situation in Wuhan is now better than in Germany. We should offer help to our friends when they are in need. We started fever clinic and isolation wards in the very beginning, and we have run 5 hospitals, including 2 makeshift ones. We have treated over 20,000 outpatients and 2,900 inpatients. More than 1,300 people have been discharged by now.
All of us have been on the front lines. We have experience. So when our German friends need clinical help, it's our honor to offer and hope the experience can make things go more smoothly for them.
Wuhan Union Hospital has shared their experience. Early treatment is very important. Traditional Chinese medicine and some new methods can also have good effect. They have also shared their experience to identify the severe patients at fever clinics and isolation wards, the principles of treating COVID-19, and some case studies.
Makeshift hospitals are unique to our experience. Not only can they treat mild cases, but also avoid further spread. The 2 makeshift hospitals we managed have had the effects of 0 death, 0 infections, and 0 relapses.
I think the most important thing is how to identify the coronavirus patients in the early stage to avoid letting them turn into severe cases, so doctors can help more patients.
We don't have any experience yet, so for us it's very important to get this information and then to newly define our treatment options that we have for the patients. So that helps tremendously.
It's evening in Wuhan and noon in Duisburg. Doctors are still discussing the clinical issue of COVID-19. And as we know, doctors around the world are also working very hard to protect our health. So thank you very much. It's said such conferences will be held regularly in the future to work together more closely. The Chinese mainland has just reported 0 new domestic coronavirus cases for the 3rd consecutive day. It's a milestone for China and also for the world. CGTN for CGTN from Wuhan.